Hi, I'm Dr. Patty, and I'm from Elkridge Family Dentistry, and I'd like to talk with you today about our amazing microscope. We use it every day in our hygiene department, and the reason we use it is because everyone has plaque, everyone has bacteria that live in the plaque, and we want to find out what kind of bacteria you have in your mouth. So there's the healthy kind, there's the unhealthy kind, and we just need to make that determination, and the microscope will help us do that. Now, we take a sample of the plaque, we put it on the slide and add a little saline solution, and then we put it under the microscope, and it's amazing all the different things that we're going to be able to see. We see the plaque, we see the bacteria, we see white blood cells, we see red blood cells, and we also see some skin cells from the gums. So it's amazing what we can see. And the thing that we were really looking for is the bacteria, because the bacteria is what causes gum disease. It causes gingivitis, and we want to be very aware of what bacteria is there so we can treat it. There are long fancy names that are hard to pronounce for each of the different bacteria. However, all we really need to know is their shape and what they do. In other words, are they good or bad bacteria? There are cocci, short rods, long rods, gliding and spinning rods, spirochetes, cigar-shaped bacteria, and trichomonads. By differentiating the bacteria, we can determine the classification of the slide. We rate the slide from a class 0. It's very little and healthy bacteria with almost no mobility, to a class 4 slide, lots and lots of bacteria with beehive activity. Here is an example of a class 1 slide, healthy bacteria. There are cocci, they're little circular bacteria, long and short rods. There's not very many of them, and they're not very mobile. In contrast, here is an example of a class 4 slide, unhealthy bacteria associated with periodontal disease. There are gliding, spinning rods, spirochetes. Those are the corkscrew-shaped, squiggly guys. Trichomonads, balloon-shaped, and there's too many to count, and they are very active. Why is this a problem? It is estimated that periodontal infection affects 3 out of 4 American adults. The bad bacteria can cause a persistent infection that attacks the gums and bone, which is the foundation of our teeth. If untreated, the infection can spread and may lead to surgery or tooth loss, and can even affect your overall health. To treat that is to do some scaling and root planing if we have to. We irrigate with an antibacterial to flush all that bacteria out, but the key is getting rid of the plaque, and that needs to be done on a daily basis, and that's what our patients will need to do at home. And we can also go over proper techniques to effectively remove the plaque from that pocket. As a team, we can work together and get rid of that yucky bacteria. And that's why we use the microscope here at Elkridge Family Dentistry. We want you to have a healthy mouth. We want you to have healthy gums. And we want you to be able to see this bacteria so you know what you're fighting against. We want that yucky bacteria out of your mouth and have healthy gums and healthy smiles. So stay tuned. We're going to go over how to do effective flossing and brushing at home. And we'll see you then.